Hi, I'm Terry Conneran and I live in Charlotte, North Carolina. Thank you so much for inviting me today to have a few minutes and kind of tell you a little bit about my patient journey and how incredibly important it is for patients to become empowered. 6.5 years ago, I was diagnosed with non-small cell lung cancer. It obviously wasn't my plan for the year, but when I found out what I had, I went through my treatment, went through chemo, and had half my lung cut out. And then I started trying to get back to my life. In the process of getting back to my life, I got connected with other lung cancer patients and started hearing about biomarkers, hearing about second opinions, getting information that I didn't realize what I needed to know or how much I really was craving that information. As I became more informed as a patient, I was asking my doctor, what's my biomarker? What's driving my cancer? Because I would see patients breaking up into groups around their biomarkers because, well, I don't need to tell you, each different biomarker works on a different type of therapy. So I'd see EGFR people and BRAF people and RAW and whatever. I see these different groups. It's like, well, what am I? My doctor didn't have an answer for me. We did the biomarker testing, but she said I didn't have anything that was appropriate for me to change treatment on. Fast forward over 2 years, I had first recurrence. At my first recurrence, I thought, okay, great. Here's my opportunity to find out what's driving my cancer. No such luck. They did the genomic testing, but I didn't get any information that anything was changing. I got back to no evidence of disease. So I'm a stage 3 patient that's had a recurrence. This pushed me to stage 4, technically. But then I go on to treatment and I'm back to no evidence of disease. No evidence of disease. So we're talking 2019. I have another recurrence and I've had enough. I want to know what's going on. I want to understand better and become more fully informed. So we go out for a second opinion to a larger cancer center. At the second opinion center, this is where I really got the information I needed. The doctor pulled up my report. She said, your first report, your second report, and when we reran your reports, it all showed the same biomarker. I had biomarkers my doctor wasn't telling me. I have KRAS G12D. That KRAS G12D didn't change anything for my treatment, but it told me what I needed to know as a patient so that I could move forward with getting information. The internet's a scary place. You just look for cancer, you're going to get all sorts of crazy things. They're trying to sell you. People are trying to take advantage of us patients. So knowing what is my biomarker, I was able to go on, find out what that meant. I fully expected to see that there was a group already organized around KRAS because, as I could see really quickly, KRAS is undruggable. So this undruggable cancer certainly must have a group. There wasn't a group. So January 2020 started this little Facebook group and reached out to a bunch of people that I knew to see if I could find anybody else that had KRAS. I got connected with a number of other people and we started having conversations. I wanted to understand what this meant. I wanted to take this biomarker, this sense of identity, and do something with it. I took that and it's like, what can I do? What is it I want? I want to kick cancer's KRAS for sure. I want to kick cancer's KRAS. But you know what? The ultimate of becoming a patient, an empowered patient, is for me to take that biomarker and turn it into an acronym, a bit of a war cry. The war cry that we have, KRAS, knowledge plus research plus advocacy equals survivorship. It takes all of those things for us to work together to kick cancer's KRAS. The knowledge comes from the doctors. The research comes from the researchers. The patients, the care partners, the families need to advocate for what it is we're all looking for. Survivorship. Survivorship isn't just getting through till tomorrow. Survivorship is quality of life and living with this cancer and learning how that we can take control and make a difference. So the KRAS Kickers has become a patient empowerment group. We're global. We're tumor agnostic. We want to walk alongside of people. We want to represent all peoples all around the world. How we do that is these are KRAS Kicker socks. On the socks, each color was chosen intentionally for the most common places you're going to see KRAS, the undruggable, which now fortunately has some options. Blue is the colorectal, white is the lung cancer. I'm talking like the ribbon colors. So white's lung cancer, blue's colorectal, purple's pancreatic, and gray is brain. And we all walk together and work together to kick cancer's KRAS. How do we do this? As an empowerment group, we want to be able to better understand what's going on. Not just take a pill, not just show up at the doctor's office, but really become engaged in shared decision making, understand what's going on. We have a demon inside of our body, and we want to know what it is, what that means, and what that means for us in our treatment, what's next. That's so strategic. The only way we are going to know is if the doctor tells us, if the reporting is done, the doctor tells us, then we take that information and we go out and we connect. That's where you all step in. You need to be able to provide to the patients the information. You need to connect the patients to the sense of community, to the sense of I'm not alone, to the sense of we're walking together in this journey. We're not here struggling alone and hopeless. We are all about hope. We're about clinical trials. We're about research. We're about understanding what it means, understanding what KRAS is and what that means for our next steps. Our next steps may be a clinical trial. Our next steps may be immuno or chemotherapy. Our next steps might be hospice. But you know what? It's our bodies and our opportunities to get involved, to know what it is that we want so that we can make life choices intentionally for what's going to work best for us. This is a matter of us, of community, about how we can work together and knowing what we need to know. Melanoma, you folks led the way. You led the parade in immunotherapy. We're so thankful for you. And the people with lung cancer and colorectals and these other cancers are really benefiting from it. We need you to keep leading the parade. We need that information. We need to share it and understand it. It's so difficult as a patient to go out there and want to understand something. And we're treated like we're just a preschooler 1 minute. And that's okay at first. But now we're being treated like a PhD, and we need to get that information somewhere in the middle. That's really where the KRAS Kickers steps in. We are here to help bridge that gap. We refer to those barriers and those gaps. Those are holes. Those are holes in the system. Those holes are KRAS holes. KRAS holes? A KRAS hole is simply anything that interferes with a patient knowing what is their best treatment, knowing their biomarkers, having the options and being able to become empowered and informed to make those choices for themselves and their family members. This isn't just one and done. We need to be all working together to solving for these problems, these KRAS holes. These KRAS holes are people, they're places, they're things. Sometimes it's just a matter of paperwork. Sometimes it's an attitude. Often it's a doctor. But we know that we need to end it. We need to stop it. We need to work together. And that's not going to happen alone. Don't put me in an echo chamber. We need to be working with you, and you need to be working with us. We need to all be working together because we need to be kicking cancer's KRAS. My name is Terry Conneran, and I'm with KRAS Kickers. And please connect with us. We have some special opportunities coming up for you as researchers, as doctors, and we loved being able to come informed to help review whether it's research, to give you opinions, real world data, connect with you, meet with you. I'll be at ESMO, I'll be at EACR, I'll be at all these upcoming events. It's not about me, it's about us. So you keep walking your walk and doing what you need to do, because we're going to do this and we're going to make progress together. So thank you so much.